Hey everyone, this is Keith with another episode of CIO Wisdom Share. This week, I think you're all going to find this conversation extremely fascinating. It's relevant, but it's also very important for everyone, regardless of your role, your job, what industry you're in. So I'm joined by a CIO who is involved with the distribution of vaccines. So with that, Jason, welcome. Thank you for joining us. Maybe you can share a little bit about yourself and what you're up to.
Thanks, Keith. I'm glad to be here today, and hopefully everyone listening can get a lot out of this talk. My name again is Jason Frame. I'm the Chief Information Officer at the Southern Nevada Health District, and we are the local public health agency in the Las Vegas area, as you can tell by my background in the Zoom. Can't wait to get back to those days when the strip is lit up like that and we have the people back and flowing through here again as we start to get back to more normal. So like I said, we're at the Southern Nevada Health District. We are in charge of all public health activities in the Valley, from the restaurant inspections, the hotel rooms, the pools, and all the fun stuff that the tourists get to see. But among that also, we are also in charge of all the COVID response for the Valley. And that meant starting a year ago with ramping up for testing and going up to, we're doing about 12 to 15,000 tests a day at one time. And now we're in charge of the vaccine distribution for the southern half of Nevada, which is about, 3/4 of the population of the state.
And so how's that just overall, just kind of how is that going? Is it smoothed out for you yet?
And we're still trying to ramp up. Unfortunately, the supply, I mean, a lot of people have heard this around in the news. The supply isn't there yet. We have a huge demand for the vaccines. Whenever we open up new slots, they get taken up really quickly. So we're at a supply issue right now of not getting enough vaccines here to satisfy that demand. So as part of that, we haven't been able to roll out to the new tiers as fast as we would like to. We just opened up now to the 65 and older from the 70 and older. We would hope to have been there, before this time. So it's taken a little while to ramp up. We are, challenged again in the supply. And then we're also now working on finding more ways to distribute the vaccine and multiplying our efforts throughout the Valley. And one of those things we've done is we worked with a number of different groups. The National Guard has been a big one. We have people from FEMA that are coming in to help us out with that. Homeland Security is sending people to help out, amongst other groups of volunteers. And we have healthcare workers that are coming in on their off hours to help out because they want to help people get this vaccine, because we all understand that until this vaccine gets rolled out, we're going to still continue to be shut down. We're going to continue to have our economies at a position where we don't want it to be. And we know we need to get this ramped up so we can get back more toward a new normal.
So, probably a few weeks ago or before the vaccine came out, you're probably sitting around just doing CIO stuff, except of course with the testing. But now you've got this whole distribution process project you've had to take on. Tell us a little bit about what you can share with us about what's the process that you've built. I mean, are you distributing this through hospitals? Is this going through private pharmacies? Kind of how's that working?
So we have a multi-pronged approach to the distribution. We do give some out to pharmacies. We give some out to the hospitals. We give some to the University of Nevada, Las Vegas, and their medical school, and they're working on getting the vaccines out. But we also do a lot of our own, we call them points of dispensing or pods, and we do a lot of those on our own. So we have 3 major pods right now going on. One of them is at one of the local high schools. We have one at Cashman Center, which used to be our minor league baseball stadium, and it has an event center as along with that. And we're also at the Las Vegas Convention Center. And for any of you who've come to CES or anything like that, the convention center, we have a pod there right now that we're serving just over 5,000 people a day, doing 5,000 vaccinations a day at the convention center. So we had to roll that out. So UNLV had their own system of doing it. And we got to the point in October where we said, well, this is going to be coming. We need to start building something and be ready to do all the technology aspects of getting the distribution out there. And so we took an app that we had built internally for the testing for COVID, and we were able to modify that a little bit to do the registrations and the tracking for the vaccines. And so really what it looks like from a logistics standpoint is the patients come online and register. And by doing that, we're capturing all the information that we can from them, which is really helping us to lower the amount of data entry that was going on in the back end. As part of their registering, they're picking an open time slot. So they're choosing what tier they're in, finding a location in an open time slot, doing their registration, and then they get a notification either by email or text with their confirmation information and a QR code that they bring to the event. We developed a mobile app that is used by our volunteers and our staff at the events that'll take that information. They can either scan the QR code or look the person up, verify that their information was entered correctly, because it's a huge thing to make sure that we have that data quality, because this data then goes up to the state and then ultimately to the CDC. And so once we've verified that, then they go to get their vaccination. The vaccinator then has to mark where they gave the vaccination and what arm. They have to then be very careful about what vaccine they gave them, so that we know if they got Pfizer or Moderna or whatever the vaccines of the day are. But not only just the vaccine name, we also have to know the lot number and the expiration date, in case something happens in the future where we find out there's a bad lot, that we then can then contact everyone and tell them that they need to come in and maybe seek additional medical attention. And we've had that happen with a lot in California, where we were able to track that, and we knew that we had about 200 doses that came from down in Southern California to one of our EMS providers here in town, and we were able to stop them from distributing that vaccine before they gave it out to anyone. So it's very important to be on top of what data is coming in and what data is going out in case something were to happen. So we built that all in house. We have a small team here. We're a government agency. We run very lean on that. We had a team of 4 people that developed that whole application.
Whoa.
And from the testing side through the vaccine side, it was the same group. And really, we had one person focused on the mobile app that was used in the clinics and at the testing site. We had one person that was focused solely on the registration page, one person who did a lot of the back end applications, so of how our team creates events and manages appointment slots and those kind of things, and then one person that worked on reporting and making sure our API was up and running all the time. So a very small team to do this. And at the peak, we were doing over 10,000 tests a day, and for a while there, we were doing about 6,000 to 7,000 vaccines a day using this one system that we used there, that we developed in house. We've had little glitches with it, really, with scaling. We opened up our second dose appointments when we finally got the second dose notification, and we saw that we had 1,000 people a minute trying to register. And so we were scrambling to make sure the site was staying up. We were making sure that everything was flowing. For a couple of days, we were really trying to stay on top of that, working 16 to 18-hour days, making sure that those sites were up and running. And also, because this was so new to us, we were making corrections and additions every night. We'd roll out new changes, roll the new app out every morning for the testing site that day, take what we learned at that site and build that in for the next night. And we were working, probably 4 to 5 nights a week, rolling out new updates to be ready for the next day. Fortunately, we're able to start moving off of that right now. The state, we work together with the state to purchase a statewide vaccine management system, and it's going to be used throughout the state of Nevada. So anyone who wants to get a vaccine in the state can go online to one central repository, register for a vaccine based on where they're at and what criteria that they meet, and then be able to manage their appointments through that portal itself. Very happy to announce that we started this project a little over 3 weeks ago. It was a 3-week implementation of a $6+ million project, and we went live yesterday morning with our clinic here with about 150 appointments, and everything worked pretty well. From the technology standpoint, there was a few little glitches here and there, as there always is with any technology implementation, but we were able to solve those really quickly. And then the hardest part for us was really the change management, getting people to understand the new process and the new flow. But we did a hot wash yesterday afternoon with our team, and most of them seemed to like the new process. They understood it really well. It was done very simply. And from an IT standpoint, of being the CIO, one thing I like about it, it's built on top of the Salesforce platform. So we know that the scaling is there. We know that it's robust enough that it's not going to crash. We had them do some testing where they were able to do 32,000 appointments in less than an hour. So we know that it's going to stand up to the demand that we have. So it gives me a little bit more peace of mind. So it really helps my team focus on serving our internal customers and helping them out with what they need, rather than trying to build applications and fix bugs in the applications. So we're going to do more meaningful work and be able to let Salesforce and the group that from MTX, who was the provider, take on those roles. And they have hundreds of people that are able to do that, where we were trying to do it with 4.
Yeah. Let me just ask you a little bit of clarification there. So
Yep.
how many total people are down in your district? Like all the different people working on this distribution of vaccines?
There's, I mean, I'd say a few hundred when it comes down to it,
Okay.
the whole scale of it. So
Okay.
in IT, we have that small part. We have at one site over at Cashman, we have National Guard, and we probably have about 75 of them to 80 of them every day giving vaccines. At our Cashman site, we have 65 to 80 volunteers and staff members running these clinics on a day-to-day basis. So it's a large effort as we're doing it. We're working with other jurisdictions. We're working with a lot of the firefighters from the different jurisdictions here in town that'll come through on their days off or when they have extra time to help do vaccines. And so I'd say when you look at the grand scheme of who's part of the response here in Southern Nevada, you're probably looking at 12 to 1,500 people that are involved in the whole process on a week to week basis.
So 12 to 1,500 people. And then tell me a little bit about the IT group that you've got supporting this. So you mentioned the 4 people, but it sounded like they were doing kind of front end.
Yep, they were doing the
Okay.
application. We have our team right now. We have total in our agency about 1,100 full and part-time employees, and we have an IT staff of 24 people
Okay. So
that
they're
are
the ones
supporting.
supporting the infrastructure for you and take
Yep.
care of all that.
So that's total. That's me all the way down through our help desk people. So we have 24 people on staff, and then we're supporting, not just the vaccines, but everything else that's going on in the district. One other thing that we've done is we partnered with the jurisdiction. So Clark County government, City of Las Vegas, City of North Las Vegas, and City of Henderson. Those are the main cities down here in Southern Nevada. They are providing IT support at some of these offsite clinics. Thankfully, though, the IT support there is very minimal. It's making sure that we have connectivity and making sure that our laptops and tablets can connect to the internet because everything is now is cloud-based. So we've really taken the IT complexity out of it and left it up now to our vaccinators to push these people through.
And is all the heavy lifting being done by this application MTX built for sale on Salesforce platform?
Yes, it is now.
Okay.
So like I said, we just went live with that yesterday um, at our main office. We're going live with it at the convention center and Cashman Field on Tuesday of next week when they open back up. And then we're going to start serving, between those two, between 10,000 and 12,000 vaccines a day.
Wow. Okay. So you got all of these people going on, this project's going, the software's running. So take a breath. And
Yep.
so what impact have you been able to make utilizing technology on this?
We've made quite a bit of impact, we started off as having everything on a paper process because that's what had always been done in the past. I can give you an idea. When we had H1N1 back in 2009, if anyone can remember back that far, we did all those vaccinations. We did probably 270 to 300,000 vaccines around that number. And then we had to hire a staff of about 50 people for a month and a half to do data entry. Now that's all being done by the patients when they come in. So that's taken a ton of data entry off the table. When we did COVID testing from last May up through the end of the year, we were doing, like I said, anywhere from 5 to 10,000 tests per day. And we did some time studies on that. And for every patient that had their tests or their lab requisition on paper, it was 4 minutes of data entry. So when you take 4 minutes times 10,000 in one day, that's quite a big amount of savings when it comes to time savings. So we're able to take that down from 4 minutes to 0, where we're automatically accessing all the data into our lab system. So they were able to now stop doing data entry and start just processing more and more tests. When we turned that system on, we went from being 7 to 10 days behind on testing to be able to do them within 48 hours, which when we were doing the testing and then ultimately the contact tracing, it helped out quite a bit. We also wrote some applications for our contact tracing because we had a responsibility to contact people within 24 hours of a positive test. Well, there was times when we were getting 2,500 to 3,000 positive tests a day, and trying to contact that many people in a day is not very easy. So we wrote an automated system where a positive test came in. If we had their email or their cell phone number, we were able to send a text message or send an email to them, letting them know there was an important message from the district. They would log in and they get their test result, either positive or negative. If they were positive, we'd start the contact tracing process immediately, where they would then start to enter in their contacts and we could start contacting their contacts and be able to then follow up a lot faster rather than having to wait until we contacted someone to start asking them all those questions. So we really ramped up for that, and that saved quite a bit of time. Unfortunately, we don't have a good measurement of how long it took before that, but we know that from being 10 to 14 days from contacting a person, we were reaching them within 5 minutes of their positive test coming in.
I assume you're probably also going to have a pretty significant impact on the efficiency of the vaccine distribution, make sure that some of these vaccines aren't wasted.
Yes, and that's a big part of it with the inventory management systems. We had we'd hacked one in our system and just made it work, and it wasn't very robust. But the inventory management in the new Salesforce MTX system is very robust, and it lets us see down to the vaccine where we are per event. And as you know, or you might have heard that once the vaccine is open, if it's the Pfizer, it has to be, or once it's defrosted, you have 5 days to use it. The Moderna, you have a little bit longer, but then once they've actually broken it up and rehydrated the vaccine, it has to be done by the end of the day. So the more variants we have in our inventory, the more vaccines we lose. And so we've really tried to minimize any vaccine loss, and we're able to now target our inventory down to the dose and know when we've lost a dose, how many have been given out, how many we have left over. And if we know that we're coming up to the end of the day and we have, say, 200, 300 vaccines left over, we're doing social media campaigns and saying, come on out, we have X amount of vaccines. If you need your second dose, or if you need your first dose, get here by 5 o'clock. And we're able to do those campaigns so we're not wasting any. And it's funny, we have the firefighters that I know, they call it the 3:30 crew. And we have people that stand outside the vaccine centers right around 3:30, knowing that we'll know right around then how many extras we have, and we'll start taking people from the public because we have to use them rather than let them go to waste.
And I know from our past conversation, I mean, you've got some, I mean, you are saving lives and this is important, but you're also looking to have a pretty significant impact on your city.
That's the hope. Las Vegas we're built on tourism, and until we can get to the point where people feel safe to come here, people feel safe to go to work in the hotels, people feel safe to come back to conventions, our city is not going to be the same. I think we probably had the highest unemployment rate. I know we were up over 35% there for a while, and it's starting to come back down as we've reopened a little bit. But until we get those venues back open where we're getting the people coming back into especially the conventions, our economy is going to continue to have, to struggle to rebound. But we know with the vaccines, we know with the testing, the contact tracing, that we're able to now bring people in safely. We've seen us open up, at 25%, and we're able to handle that. So we're starting to slowly work back up. And the key will be, with the vaccines and getting more and more people vaccinated, that then those conventions will come back, because that's really the lifeblood of the city when it comes to the financial aspects.
Those are some pretty significant outcomes for, for a CIO to be helping accomplish. So congratulations on that. That's a big deal.
Thank you. It's and our philosophy here is we're always thinking about the patient. We're always thinking about, our customers, and having that, really instilling that mindset in all of our team here, that it's all about the customers. It's, we go out of our way to make sure that things work. And so with the vaccine, we had multiple customers. We had the patients, of course. We have the other jurisdictions in the hospitals and the pharmacies, and we have our internal customers with our staff and our nurses, because they're the ones who are doing the, the hard work of putting those needles in the arms. And we want to make sure that we're taking any hindrance out of their way so they can do that as efficiently as possible.
Well, that is great. So thank you for sharing that. Just a couple of questions.
Yep.
So when you went to design this whole process, did you talk to peers or colleagues anywhere around the country, or did you guys just have to jump in and just kind of make this up as you went through?
We really just jumped in and made it up as we went along. When the testing started, there wasn't a whole lot out there because it was so new, that we just said, we're going to take our platform that we've built for other stuff and we're going to modify it and we're going to make it work. And so we built it from a standpoint of thinking, how can we make this better rather than people standing in line? We saw last summer, right before we rolled out our testing registration application, people would show up at 3 a.m. to wait in line for a clinic that opened at 8. And then they'd be waiting in line till, noon or 1 p.m. And in Las Vegas, and it's still pretty hot. We had people that were passing out, people that were getting dehydrated. So we were passing out water to them. Once we were able to do this, and we could really tell them, what, your appointment is at 10:30, show up at 10:15, you'll be in at your 10:30 appointment. So we're able to free them up rather than standing in line and, risking heat exhaustion or heat stroke, to be able to say, what, if you want to go down across the street and get a drink, go for it. your appointment, your spot in line won't be taken because you now have an appointment. So it really did help out the whole community by injecting technology into it. And then we, like I said, we hadn't really seen a whole lot. We were into it. We had been using it for a while. We started to see other applications come out. When we took our testing application and we started doing the vaccines, it was the same thing. There wasn't really much for vaccines out. After we got into it, 3 to 4 weeks, and we had a working system, we saw we saw one from Salesforce, we saw one from another competitor, and ours looked very similar to what theirs did. The look and feel is a little bit different, but the way that we processed it was actually pretty much the same as these companies did, which made us feel pretty good that we did it the right way.
So I'm curious about how you have a lot of people, you have a lot of expenditures in this. You talked about a $6 million project, but I mean, how are you guys, are you guys being reimbursed for all this effort that you're making and costs?
Yeah, so the $6 million project, that was for the Salesforce. That was all paid for by the state. It went through the state Department of Public and Behavioral Health, paid for that through grants from the federal government. We also received from in testing through the CARES Act, we received a lot of money through that because we're the primary agency for it. And that allowed us to hire just under 500 contact tracers, and along with ramping up our infrastructure and the IT needs to manage those people. And then we had a few other grants when it came to the testing aspect. And now with the vaccines, of course, there's more grants that are allowing us to hire more people to do vaccinations, to allow us to make sure that our capacity is there when it comes to infrastructure, from laptops and headsets all the way up to servers and networking gear. So the government is, really rolling that out. You hear a lot about the stimulus plan, and there's pros and cons in that. You're going to hear both sides of the story whenever you listen to a news story. A lot of the money that's in there that people don't understand goes to the applications like this that allow people to get the vaccine easier, but it's not really easy to explain to the public where that money goes.
Two quick questions and I'll let you go.
Yeah, no problem.
One is, do you see any of this process that you've built? Do you see any of that stuff sticking? Is that going to change supply chain or anything in healthcare, do you think, going forward?
Definitely. And the system, and one of the reasons why we chose the Salesforce system over some of the other ones, is we saw this being a long-term partnership with them to take our state vaccine registry, which has been around for 20 something years, and it's on very old technology. It'll help us to modernize that. And we see this as a platform that we can now grow on and use for other applications in the future. And the same thing with some of the stuff that we built in-house for the COVID testing, and with the automated notifications for people who are testing positive for COVID. Once we've fully ramped up the Salesforce thing, we're able to transition our staff off the development. We're going to start modifying the app that we built for our testing notification to be able to do notifications for our other communicable diseases, like the syphilis and the gonorrhea and all that, to really help impact those communities in a much more timely manner now that we can use that technology that we've built.
Well done. Last question. I'm going to leave it to you whether or not you're going to commit to dates, but I don't want people coming back looking for me because you said something that was, but how do you're through this, you're in the middle of this process now. I mean, are you optimistic for Vegas? Are you optimistic for this country of being able to get these vaccines out and, we head in the right direction?
I think I'm cautiously optimistic. I'm not as optimistic as some people. I don't think this is going to be out by late spring, early summer. This is going to be a process that takes us probably into late fall or early winter, just because of the supply chain, getting that supply out there, being able to have enough supply to meet the demand that we have. I mean, we're Las Vegas. We have 2.6 million or so people in the valley. That's not a whole lot of people. When you look at California, you look at Texas and Florida, just think of the vast amount of people that would need to get vaccinated. And so far, the only two that would have been approved right now take 2 vaccinations. So now you got to double up the number of appointments that you've had. You got to double up the number of doses that you give. So that's just going to slow the process down. So like I said, cautiously optimistic that by, hopefully by late, mid to late summer, we're starting to get into that tier of general population of anyone who wants it, and then roll that out through the fall. And hopefully by the fall, and I'm a big football fan, I'm hoping the football comes back, that we can actually be in watching games, and rather than sitting there just watching them on TV.
Thank you for what you're doing. Thank you for taking the time to come join us and kind of explain some of that. A lot of that is just new for me. So I appreciate it. Good luck with everything.
Yeah, thank you. I'd love to be here. I've been, like I said, on a few of the other executive council calls. I always enjoy the topics. I always try to find something out of each talk that I can take and then, implement in what I'm doing. So I hope someone can find something that I've talked about today and use that to help them out.
That's great. Hey, well, thank you very much. We appreciate you being here.
Okay, thank you a lot. And, hopefully once we're back open, you can make it out to Vegas.
Hope you heard a few things that triggered some new thinking for you. We do these conversations on IT topics weekly, so please feel free to subscribe to our YouTube channel. That way you get updates on new content, as well as you can post comments and, more importantly, suggest topics that you'd like us to address. You can see that we have some pretty amazing resources, so please let us know how we can help you on your upcoming digital transformation and enterprise IT projects. Thanks very much. Until next time.